All right, we have an extra special guest today. We've got Dr. Rachel Rubin. She's a board certified urologist, also fellowship trained in sexual medicine. She is assistant clinical professor in urology at Georgetown University, and she also owns her own practice in and around DC. She provides comprehensive care to all genders and treats issues such as pelvic pain, menopause, erectile dysfunction, low libido. If you're watching on YouTube, you probably already got that from her background. Dr. Rubin is the director at large and former education chair for the International Society for the Study of Women's Sexual Health. She's also the associate editor for the Journal of Sexual Medicine Reviews. Her work has been featured in New York Times, NPR, PBS, and she has been named a Washingtonian top doctor for the past 5 years. So Dr. Rubin, I'm not sure with that resume why you have time to come and talk with us, but thank you so much for joining us.
Jesse, I would move mountains to talk to you. You are a superstar.
That is an amazing, amazing resume. So thank you so much. We're a physical therapist. Obviously, we love to help people exercise. So I always love to ask, if you could only do one exercise for the rest of your life, what would it be?
I would say yoga only because I find it calms me. It allows me to have that slowness, which in my life I chase quiet and I chase peace and I find myself running around like a crazy person. And I find yoga allows me to, I don't do it enough. I certainly don't do it enough, but it allows me to feel that stretching, but also that, sort of gaining some, strength.
Yeah, the mental piece of exercise is awesome. And knowing you, how often do you actually find that peace?
It's a great question. Not enough. I continuously chase it. But I actually have, this is going on a tangent, but like, I actually am very intense. So you could hear by my resume that I'm an intense person. And I was not someone who exercised very often. And I had to make a deal with myself about I needed to be less intense about exercise, but do consistency instead. And so I made a deal with myself and I said, a marker for success for me is going to be 2 to 3 days a week, 10 to 30 minutes a day in my basement. And that will be me like happy and cheering myself on. And so every Monday morning, the clock starts over on the next week. And I think I'm 97 weeks in a row but it's not intense. It's like actually the opposite of intense. And I need to do more and I need to build more muscle. And I still feel bad that I'm not doing more. But the consistency, I can already see changes. Even with the 10 to 30 minutes, 2 or 3 times a week, I feel more muscle. I feel like I've done better. And it's that part has actually been very cool to watch.
Yeah, I actually don't think that's a tangent. I think that's an awesome message to start with that we weren't even planning on talking about. Consistency is so much more important than intensity. So I think that's an awesome message. As somebody we both know, I was just talking to about their back pain, and my suggestion was 5 minutes 3 times a day of getting exercise is just an awesome start. And they were real. And once they started doing that, they were so happy with that. And it doesn't seem like a lot, but the consistency is so important.
It's wild how I have been able to see more muscle definition in my arms, in my core, in my legs by doing this. And I do weights actually even more than I do cardio. I walk, but like not enough. I don't do anything enough. But even just being proud of myself for the small bits that I do. And I actually have a running list of wins on my phone where I list of like, hey, I went on a date night, like I put it down, or hey, I had a get together with my girlfriends, I write it down, and then I have my running. It's been 96 weeks, 97 weeks, and I use little emojis, so like I have like a muscle for like how many weeks it's been, and it reminds you because life is hard and stressful and complex, and we're so busy. We're practitioners, we're business owners, we're doing all these things. It's actually the small wins that bring me personally the most joy. It's I'm consistent with exercise. Oh, I drank water today and I actually took time to have lunch with a friend. It turns out it's the small stuff the whole time. And that part, once you realize that, life is like a very joyful thing.
That's awesome. Again, totally not what we were planning on talking about, but if people hear nothing else except celebrate your small wins, that's a great takeaway. So let me focus back on you a little bit. So tell us a little bit. That resume was impressive. Tell us a little bit. Who is the type of person you like to help the most?
Yeah, so I joke I'm a sex detective, right? My job is to take people with complex stories and concerns and help to deeply connect with them and help get them to understand their body and their sexual health in a way that we can come up with a plan that optimizes it and makes it the best ever possible for them. But I can't do that unless I get to know them and understand who they are, where they come from, what is their medical history, what is their surgical history, what medicines do they take, how are they raised, who are their partners, what do they care about, what are their goals, what's their trauma history, what's their cultural history. So you can't do that in 10 minutes, right? You can't do that with a super quick visit. And so I created my own practice. Gosh, in January, it'll be 3 years, if you can believe it, Jesse, because he's known me since the beginning. But if you, if you take time with people, it is so beautiful, the absolute connection you can get, but also the knowledge you can help them with to understand their own body, their own sexual health, their own quality of life. And so you just see better outcomes. You see people do better. And so we see people where society thinks that things like low libido or orgasm problems are small issues. Those aren't really important for medicine. We see them as huge issues. And because people it really affects people's quality of life. And so we see a very wide range of things. We see all genders. We see problems like pelvic pain. We see a lot of pelvic pain, but we see menopause issues. We see low libido. We see orgasmic dysfunction. And then we see a lot of weird and wacky, sort of the stuff that many people haven't heard of or don't really focus on, that we become experts in because we care about the rare things that sometimes actually aren't so rare. So we see a lot of rare sexual medicine conditions. And it is just so much fun to help people with these issues.
That's great. And there's so much I want to dive into there. So let me start with, I think the first thing you said was so important. Like, just spending time talking to people really just goes a long way, especially when you're dealing with things as intimate as what you're talking about. So 15 minutes just isn't gonna take it. I also think you said, people often minimize their issues. Why do you think people with sexual issues or sexual dysfunction or pelvic pain, why do you think they minimize it, or why do you think they maybe delay seeking out help or don't know where to go?
I think part of it is that they have no language around it. No one ever taught them even what their body parts were called. Can you imagine showing up at a doctor and saying, my face hurts, right? Well, is it your eyes? Is it your ears? Is it your nose? Is it your mouth? Because that's important to know what kind of doctor to go see, because we have like 20 doctors for our face, right? But when it comes to the genitals, we feel shame and guilt. We examine under a sheet that nobody can see. We even call it down there. We have weird names for it. So the language is a problem. The shame and the guilt is a problem. The thinking we should know more than we do is a problem. And also, though, who do you go see, right? Like, you and I have both been to the doctor in our lives over many decades, and yet I've never had a doctor ask me point blank about my sexual health in any connective, meaningful way, and I assume you haven't either. And so when you've never been asked about this, why would you bring it up? Why would you bring up these issues to your doctor who talks to you about wearing a seatbelt and what your blood pressure and your cholesterol panel is? They don't really seem to care about what does sex look like for you? Are you is it okay? Do you have questions about it? Do you have any problems? It doesn't seem like an appropriate context to bring up those questions. But then maybe if you say, okay, I'm going to go to a sex therapist because that seems like an obvious choice next, they don't know anything about biology. The sex therapists don't know what your medications are doing to you, or if you have an anatomical problem or a physiological problem that's going on. And so it gets really like shame. You end up just doing nothing because you say, oh, there's more important problems than my libido. I will just sit here sort of unhappy, assume there's nothing I can do.
Yeah, I think that's true for a lot of physical pain. We see it all the time in physical therapy. People minimize their back pain, they'll minimize their shoulder pain, but I'm sure
I've been minimizing my knee pain.
Exactly. But I think that's probably 10 times, 20 times as true for something as, personal as like pelvic pain, because I think what you said at first was something I had never even thought about, was we don't really have language around it. Like you said, like we don't, we're not taught how to speak about it. So that's why I love your Instagram. So I'll give you a little shout out for your Instagram. What's your Instagram handle?
It's my name, Dr. and then Rachel Rubin, Dr. Rachel Rubin.
Yeah, I love your Instagram because you're giving people that language, and you're kind of putting it out there that it's okay to talk about these things, and that has to make people feel so empowered, where maybe for years they haven't even been able to. They didn't even know it was a thing they could talk about, and then they see your social media, and it's like, oh, this is great. this person is speaking exactly what's in my head and I didn't know how to say it.
It was so beautiful. We had a patient today who had a mirror, and we were giving her a tour of her genitals, as we often do. And we said, this is your labia majora, this is your labia minora, this is your vulvar vestibule, this is your clitoris. And this was not her first visit with us. And she said, I just want to say how when I first came here, I was really uncomfortable and bothered by looking down there. I was really grossed out and it was really weird for me. She said, now it's another body part like anything else. And I find, and it's so much easier to do now. And I'm so grateful for access to this part of my body that was such a shameful place before.
That's awesome. That sounds really empowering. I'm guessing that's kind of the feeling that you want people to have, is just more empowered about their body and their recovery and things like that.
And it's great, right? It gives you hope. And if you can see the problem with your eyeballs, right? The patients that you see that truly understand why they're in pain and what is going on, the treatment strategies are going to be stuck to because it makes so much more sense to them, right? If it logically makes sense to them, they're going to stick to the treatment plan, and they'll have the patience for, this isn't an overnight thing, right? Like you got it, because your frozen shoulder is like X, you're going to have to do X, Y, and Z, and this is the timeline, and this is going to be what it takes to get it better.
Yeah. So you mentioned treatment strategies. So I'm sure what you work with is incredibly complex. So to help us understand how you help people, do you have a recent success story of someone that maybe didn't think they could be helped, or they were stuck in the, circle of the medical system that you've been able to help recently? Any stories you could share there?
Yeah, I think we had a person recently who, we're doing these fun things on our Instagram where patients will make memojis telling their stories. And it really is nice because you hear the patient's voice, but it's totally anonymous. And she talked about the fact that she was seeing doctor after doctor after doctor. She had pain with sex for 10 years and nothing worked. She tried so many things, nothing worked. And what ultimately helped this person was the fact getting her off her oral birth control pills, which was causing changes in her vulva to make sex painful. It was hormonal changes. And by changing the way she did birth control, by adding a hormonal cream to her tissue, and actually by working with a pelvic floor physical therapist, because thank God for people like you and your colleagues, right? We're able to get the muscles to relax and release once you got her tissue healthy again. And even adding something like botulinum toxin, or Botox is the other name, to the muscles to then allow the physical therapist to get to deeper layers and to get this muscle to sort of do what we want it to do. She is having pain-free sex. Like, not like, oh, it's only a little bit painful, like pain-free sex, which she never thought was humanly possible. So when I walked into the exam room, she just had tears in her eyes and just said, life-changing, right? And I think, the treatment wins. We do a lot with hormone therapy, whether it's testosterone for a man or menopause hormone therapy for women. The magic words that I hear every day, which are addicting, by the way, which is why I work so damn hard, is, Dr. Rubin, I feel like myself again. I feel like me, right? The man with low testosterone who's dragging and falling asleep at the dinner table and has no libido and erections aren't working very well. If you fill his gas tank, he'll say, oh, Rubin, I'm back. I feel great. I have energy. I feel good. Now I can exercise. Now I can go to the physical therapist. Now I can work on X, Y, and Z. I've got it in. I've got that pep. Same thing with women in perimenopause and menopause. Their gas tanks are empty. And so by adding some fuel, it is so beautiful to get them to come back and say, I feel like me again. And the more we educate people, that's why we're so loud on social media, is because doctors are not taught not only how to do this, but why it might be important and why it might be worthwhile.
That's great. To talk about just tell us a little bit. I just heard that you're starting to now teach other doctors what you're doing.
So I've been teaching a long time, and what I found is I get asked to give lecture after lecture all over the country, sometimes even all over the world. And even though I get a lot of praise for I'm funny, I make jokes, I have this nice lecture style, no matter how much people say they like my lectures, it doesn't seem to move the needle. That 1 hour lecture doesn't seem to change, right? It would be like you lecturing on physical therapy for 1 hour. It's not going to make someone a good physical therapist, right? And so I've been sitting with this and kind of frustrated with this because more people need to do some of the things that we know how to do because we're seeing so much success. And so I've been wanting to do this for like 4 years, but you'd be mad at me. The tech has always held me back of like, how do I do this? How do I organize it? How do I get it? And finally I was like, screw the tech. I'm going to just start progress over perfection. Let's just get a Zoom with a paid account and have people come and we're just going to do it. And we had almost 200 doctors sign up, to give them a mentorship course about teaching them how to, how to prescribe hormone therapy, why it's important, why they can do this. And it's just piloted. So, we just started it last week, and it has just been a dream to really advance how we teach people how to do this deeply.
That's awesome. And the reason I wanted to ask about that was because from our side, and what you said earlier, it seems like a lot of people go to their primary care or another type of doctor, and that doctor doesn't really know kind of how to handle what they're dealing with. So it sounds like you're starting to get the message out to more and more doctors. So my message to people would be, if you're dealing with an issue, low libido, pain with sex, low energy, things like this, find a doctor that does understand it, reach out to Dr. Rubin. So I think just you trying to teach doctors is a good message that, hey, there's someone out there that can help you with what you're dealing with.
The other thing of where our worlds collide and is really like absolutely mind-blowingly new information is a paper that just got published that has thousands and thousands and thousands of downloads, is a new term that we're calling the musculoskeletal syndrome of menopause. And the best way that I can describe it, and it actually makes perfect sense, is hormones provide lubrication, right? Estrogen makes the vagina lubricate. Testosterone gives you oily skin and acne if you take it at high doses, but it lubricates your joints. It gives you joint fluid, and it decreases inflammation. And so if you don't have fluid around, things are going to get dry. They're going to get inflamed. They're going to be irritated. And so we see so many women, especially in that 40 to 50 range, where all of a sudden they don't feel like themselves and their bodies are falling apart, and they get frozen shoulder, and their back starts to hurt, and their SI joints go crazy, and their knees start to go plantar fasciitis in their knees. And no one is telling these women, hey, your gas tank is going a little crazy. You should consider filling it with some hormones, and we might be able to help this thing.
Yeah, I actually just saw that. And, I had probably a month ago, I was working with someone. She was, I think, 48, so right in that age range. And we were working on a couple things, and things just weren't getting better. And then she on her own, we were kind of talking about her progress, and it was a little bit slower than we wanted. And so she started going on hormone therapy. And man, her progress just rapidly accelerated after that. And it was really, really awesome to see.
And those stories we need those stories to disseminate in the physical therapy world, not just the pelvic floor physical therapy world, which they've been talking about hormones for, a good number of years now. But in the general physical therapy world, I think it is your lane to say, like, hey, your ortho who brought you here doesn't know shit about hormone therapy. You actually need to see someone, and your gynecologist also may not know how to do this, but this is actually really important for the rehab of your joints that we're dealing with right now.
Yeah, and I'm sure you've seen the research that shows the research about the research that any new information in healthcare takes 17 years to actually become mainstream. So I'm hoping
that
you
have no hair because you've ripped it all out. Correct?
Exactly. I haven't had a hair for a long time, so I don't know what happened. Maybe I need to go on hormone therapy. Who knows?
That will make you lose more hair, probably.
But yeah, I'm hoping to get that message out earlier, and I think that's why I love your social media. That's so, like, you called it loud. I just think it's good loud because you're fighting the good fight.
I hope so. And that's, again, I think, for anyone listening who wonders, like, people don't care. My social media is really there to try to present real good quality information to as many people as I can. I don't care what I look like. I don't care what I sound like. Like, it is like people are dying and people are getting really bad advice and they're not getting the care that they need. And so I produce content to try to help those people. It's not about me. It's about them.
That's awesome. I think that's a great message for anyone on social media, actually. So you just mentioned getting bad advice. One of the things that we try to do, like one of our approaches is just, simplify things. And people get such bad advice, don't round your back and sit with perfect posture and all these things that are meant to be good that actually end up harmful to people because it makes them afraid of their body. What's one big health myth or big misconception or one piece of advice people think that you love to bust all the time?
Ooh, there's so many. What do I love? What myths do I love to bust? Oh, that it's all in your head. That's easy.
Yeah.
that it's all in your head. Your low libido is because it's all in your head. Your pain with sex is because it's all in your head. Everything's about psychosocial. Everything's because you had a history of trauma. There is no question those things are important and a really, really important part of the puzzle. But we minimize biology so much because it's so easy. This is where I fight with sort of the pain. I'll get a lot of hate for saying this, but I fight a little bit with the central sensitization concepts because I feel like it's a way to just say, oh, this is central sensitization. We don't have to look for a cause. We don't have to look for an answer. This is just all in it's like a modern day fancy way of saying it's all in your head. Now, that's not to say your head isn't a huge part of your body and a huge biological piece of your body that plays a very essential role in pain and processing and all of those things. And I think, though, when it comes to the problem is these words get thrown out too easily. I think a lot of fibromyalgia is perimenopause. I think a lot of interstitial cystitis is hormonal changes. I think a lot of pelvic pain is hormonal and musculoskeletal. I think we minimize all these problems by just saying, oh, it's all in your head. Just, do more breathing and yoga, do more mindfulness.
Yeah, I think that's a good message because I think from our practitioner side, for anybody that's listening that's not a practitioner, I think there's always a pendulum in medicine. So for a long time, we were only focused on the tissues and only focused on the biology. And then we realized that, hey, there's actually a psychological and social component to pain. And now we might have swung a little bit too far to the other direction. And like you said, it's not all in your head. We have to figure out what's the biology and what's the tissue that we need to work with. But then also, like you actually brought it up at first, you're not ignoring the psychosocial. You talked about, what's their love life like and what's their home life like and making sure that we're taking all of this information into one. And I would just encourage people to work with a provider that takes all of it and doesn't ignore the biology, doesn't ignore the psychosocial, and what are all the different components that could possibly be playing a part.
And that's why it's unfortunate that your doctor who has seen you for decades and takes insurance and takes 10 minutes with you, like they may not be the right person for that big, they may not have the training or the expertise or really the interest. It may, we can't, I am not interested in your pap smear results. Like I am, like it's not my expertise. I'm not a gynecologist. Like it doesn't excite me in the way that wanting to talk about your sexual health excites, right? Like we all have different interests and things that excite us and make us want to go to work every day. And so you have to see someone, if you deeply care about the quality of your orgasm or the libido that you're having or something else, like you want to see someone who cares about it as much as you do and working with someone. And that unfortunately in medicine is very rare these days because there aren't a lot of people and we're working. That's why I yell loudly because we're working on training more, teaching more, and really realizing that this is what people care about. They care deeply about these things.
Yeah, and so I think there's a lot of people out there that, like you said, like they don't even know that these options exist. So someone who's listening, how would they know that you or someone that practices medicine like you, if they're not around here, how would they know that you might be a good person to reach out to?
Yeah, I think for us, we often give advice on, one of the easiest ways, if you're a woman, the International Society for the Study of Women's Sexual Health, or ISSWSH.org. It's a lot, I know, but ISSWSH.org. They have a Find a Provider, and that is a great place to look for people who deeply care about women's sexual health. If they're on that website, they deeply care. That doesn't mean they know all the answers, and that doesn't mean they're going to fix you in one visit. It just means they care enough to really get that extra training. If you are a male with sexual dysfunction, the same can be said for the Sexual Medicine Society of North America, smsna.org. And if it's menopause only, then menopause.org also has Find a Provider. I happen to be on all three lists because these are just sort of the intersection of what my passions are. But you can certainly find a provider in your area.
That's great. So what's one thing, you might have already brought this up. I think I know your answer is going to be, I was going to ask you, what's one thing you think we should be talking about more when it comes to pain or sex?
Yeah, I think it's language, and I think education is the thing that's really important. I got really famous because I had a picture in the New York Times science section, a full page in the New York Times science section about how I give women a mirror and I teach them about their own genitals and I show them their clitoris and I do research on the clitoris and I just show them where it is. That was in 2022. That was science in 2022. It's so embarrassing, right? That I got all this attention and all this viral attention for something that seems like we should have had that figured out by now. And it's kind of wild. So really education, even though we have cracked all these crazy intense codes with cancer, with going to the space, with all these things, we still don't have basic research on the anatomy of the female genitals. And that is hard to hear and to listen. And so that affects people's pleasure and quality of life and health. We are not using the tools. Do we need a lot more research and a lot more tools? Yeah, we got a long way to go to give people good sexual medicine care. But most doctors aren't using the tools that we already do have or have had for decades. And that is what infuriates me the most, is that we talk about how bad women's health is, how much more work there is to do, when we have millions of people not getting access to the already life-saving good treatments that already exist. And that's really depressing. Like the Menopause Society meeting that just occurred, they said that right now, 1.8% of women are using hormone therapy. Only 1.8% of women. We know hormone therapy decreases fractures. We know that it cures hot flashes, and that it absolutely will cure the genital and urinary symptoms that happen in menopause. And only 1.8% of women are using this. That's criminal, right? But and that's actually worse than 10 years ago. So you can't blame studies from 30 years ago, because 10 years ago we were better. Why? Because all the old doctors have retired. The old doctors who used to know how to do this, they all retired or died. And now you have a generation of doctors who have no idea how. That's why we started the course. They don't know how to do it. So it's just infuriating of like we have to start using the things we already have access to.
Yeah, two things I take away from that is I couldn't agree more. I think oftentimes we search for, okay, what's a better option, or we need to make this treatment better, or what's the more perfect treatment plan, when we're not already optimizing what we currently have. So what does it matter if we're doing things better 10 years from now if we're not actually using things now? So I always it's a very common saying, but don't let perfect be the enemy of good. Like if there's so many more things we could be doing right now to help people, like right now, rather than waiting 5 years for it to be even better.
It's also the foundations, is people ignore the foundations, right? I can't tell you how many people get surgeries, and I'm sure you see this all the time in the physical therapy world. People run to surgery when they don't have the foundational elements of healthy muscle, healthy tissue, healthy this and that. Their outcomes are going to be worse, which means the research is going to show shitty outcomes, which is going to show. So it's a huge problem, because again, crap in, crap out when it comes to research. If you're not studying the right things, it's a huge problem.
Yeah, a dirty secret of the medicine world is most surgeries, the research shows people aren't actually any better off a year after they get surgery. Right. So I think what you said is true, is if people aren't trying like the foundational things before they go through surgery, A, they might not need surgery, but B, even if they do need surgery, your outcome is going to be so much better. Yeah. So there's almost no harm in doing the foundational things, whatever that foundational thing is, whether it's hormone therapy or strengthening or whatever the thing is. Just do the foundational thing first before we jump to the more complicated answer.
Totally.
Yeah. So what's one piece of health advice you want to leave people with? Like, what message do you want to leave people with?
Do your homework. Stop thinking, oh, this stinks. Everybody else has access to this and I don't have access to this. Woe is me. My doctor won't give me this. I can't do this. I can't have this. Stop it. You are a human being who can learn. You are smart. You are educated. You can learn. If you're listening to this podcast, I want to be your best friend because you have access to this information. There has never been a time where it is easier to get access to good information, free information, and really good advice. You can learn things. You can ask questions. You can question authority, and you can show up to get what you need, because what you need, and now I can't tell you what you need, listener, because that's what is the hard part about Instagram. I can't tell you what I think you should do in one Instagram post, but you have to advocate for yourself and find a team that will help advocate with you and find the right people for you. And you can find them if you do the work to figure it out. And yes, that's challenging. And yes, medicine is broken. And yes, sometimes people have to travel or invest or to look at that. And sometimes you get the wrong horse or you bet on the wrong thing or it turns out it wasn't so good. But don't give up. Do not give up and just keep learning and figuring out, because no one will care about you the way you care about you. And so you have to show up and you have to invest in you, and then it'll be a win every single time.
That's such an awesome message, and we can bring it full circle. Your success story you shared, I believe you said she was having pain with sex for 10 years and got no answers, right? So she didn't give up. She probably was ready to give up.
And you know what? It wasn't me that is the win there. She did the work. She found me. She listened to me. She trusted me. And then we built a team around her to support her. And now it's pain-free. And she said, lifesaver. Yeah. Lifesaver. And who's the winner there? She did. She did the work. She's the hero. And that is like, this gives me chills. Again, it's the simple, it gives me chills because I don't know that I would have done that. I don't know that I would have had the energy to put that much effort and to keep trying. And it's so inspirational. And when you see the wins, it's just, that's why you want to just shout it from the rooftops.
Yeah, I think that's great. And I also think it's important, like what you just said, like, I think it's important for us to acknowledge, that 10 years must have been exhausting for her to keep trying and keep researching. So we totally understand that, if you're dealing with pain for a long time, it is exhausting to keep thinking there's an option out there. Our only suggestion is there still is an option out there. It's just, you have to keep fighting through it. And just like her success story earlier, even if it's 10 years, the next 30 years of that person's life, she's going to enjoy so much more. So yes, it is exhausting.
Take breaks.
Yeah, there you go. It is exhausting, but there's answers out there. So Dr. Rubin, this was phenomenal. Thank you so much for giving us your time. So you just said, if people, the one thing you want to leave people with is find information. One of the best places is you. So how can people find you?
Yes, please. We have a newsletter. I promise I don't spam. I send really cool articles and all sorts of fun stuff. rachelrubinmd.com. Please sign up for our newsletter. Please follow us on all our social media channels. It's Dr. Rachel Rubin. We have an awesome YouTube channel we just started in honor of my 40th birthday. I started a whole playlist of why you and your loved ones all need, if you have a vagina, why you need vaginal hormones to prevent urinary tract infections. And we are we are trying so hard to answer every question that ever existed on vaginal hormones to prevent urinary tract infections. So if you know anyone who's had a urinary tract infection, go to our YouTube channel. And then, of course, Instagram. We're having a lot of fun on Instagram these days. So please, would love for you to connect with us.
That's great. And I will vouch for your newsletter. It's entertaining. It's good. I mostly follow it just to see who you're hiring now because you're growing so quickly. But congratulations on all of your success, and thanks for joining us.
Thank you.